As a doctor, I treat patients and often come across problems requiring solution. I felt the need for a test that would help prescribe cancer drugs to only those patients who really need them. I was sure that there were patients who suffered unnecessarily, and I resolved to dedicate my life to solving this problem. That's where I began. Personalized therapy. It was a challenging goal targeting one of the biggest problems facing humanity, cancer. In the case of breast cancer in particular, most patients, regardless of the disease stage, had opted for chemotherapy and suffered serious side effects. Dr. Soonmyung's work changed this. For breast cancer, for which recurrence was hard to predict, he wished to develop a more precise diagnostic and treatment guidelines and free patients from unnecessarily suffering from the side effects of chemotherapy. He discovered that HER2 gene found in about 20% of breast cancer patients was related to recurrence. Based on 10 years of clinical studies, he proved that Herceptin targeting HER2 gene significantly lowered the rate of recurrence in patients who received breast cancer surgery. 10 years after the discovery, Dr. Paik succeeded in developing Oncotype DX, a diagnostic method used to selectively prescribe chemotherapy, which had been previously performed as a part of standard care for patients who have undergone surgery. Oncotype DX involves tests for genes associated with breast cancer to determine whether a patient needs chemotherapy.
And this is very important because we tend to overtreat women with chemotherapy. We give chemotherapy to women who do not need it, and the test is clearly helping us to make a distinction between women who are going to be cured with endocrine treatment alone and women who will need chemotherapy in addition to endocrine therapy.
Currently, Oncotype DX is a standard procedure for oncologists around the world in deciding the course of treatment and enables personalized medicine. Dr. Paik has given freedom to breast cancer patients from having to choose to receive post-operative chemotherapy to stem the uncertain risk of recurrence. Dr. Soonmyung's research will pave the way for personalized therapy for patients of various cancers. Doctors must not give up because we have patients to help. We must never give up.